Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg, and I am a research study coordinator here with the Havey Institute. I will be leading today's discussion. It's my honor and pleasure to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Well, good morning and welcome back, Katie. Katie was with us at the beginning of this whole exercise.
It's great to be back. I'm so happy to be receiving your COVID questions. And of here, the introduction, Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID questions here each week on the Havey Institute for Global Health Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, May 11th, 2023. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Thank you so much for joining us, and I'm going to start with some updated COVID statistics. As of yesterday, May 11th, the New York Times reported that there was an average of 11,037 new cases per day, an average hospital admission of 4,277 people per day, and approximately 158 COVID deaths reported per day. We are staying steady at 17% new booster proportion. Dr. Murphy, do you have any comments?
Yeah, so today is a momentous day in that it's the official end of the COVID pandemic in the United States. WHO has followed along and they also have ended the pandemic stage. That doesn't mean it's gone. Obviously, there's still cases and people are still dying from it. But the pandemic is over, and now we are officially in the endemic stage, very similar to the flu. Flu never went away after the 1918 flu pandemic. And so we're going to have to live with this now. And so there's a lot of changes because the emergency around the pandemic allows for the public health authorities in the country and around the world to do all sorts of things they normally don't do, including reporting. So all that's going away after today, but it will still be reported as causes of death, causes of hospitalization, just like we record all the other diseases that are out there. So we'll be getting fewer reports and limited data related to hospitalizations and deaths, but nothing else, not number of cases per day. The laboratories will no longer be required to report COVID cases, which they are as of, that ends today. So it's a really big change, but remember, COVID's not going away. As far as this show is concerned, we will continue to follow updates. There's going to be more treatments. Of course, there's going to be some big stumbles as we go forward. There's going to be outbreaks around the world. Maybe there's going to be a new variant. That we have to be very careful of. We thought in the summer of 2021 that it was gone, and then Delta came, and Delta was not only more transmissible, but more severe. So we've got to be careful about that. So it's not over, but we've definitely downgraded one big notch. But we may, on this show anyway, we may cover some other important infectious disease related health issues. But we'll continue once a week, at least for the next, for this year probably, and we'll see how it plays out.
Yes, exactly. And if those out there, our viewers, would like to submit other infectious disease, public health related questions to the same places mentioned before, we would be happy to take a look at those and answer them.
Yeah, there's measles outbreaks, there's all sorts of things, Ebola creeping back into the picture in some places. People are traveling a lot now. So, we can cover any of that material.
Yes, we look forward to seeing all of your questions. So speaking of a new variant, which you mentioned there, the current new variant that we're seeing now, we had a submitted question asking that they heard pink eye was more common with the new variant. Do you know how common that is, or has that been
Yeah.
prevalent?
This is the Arcturus, it's called Arcturus variant. It's also called XBB.1.16. Took off really very first in India. It has then subsequently spread. It's taking over here. It transmits easier. And doctors tend to be reporting more pink eye or conjunctivitis, we call it. Pink eye has been reported from the beginning. However, it appears in some groups they're reporting it a little bit more. But I think the take-home point is if somebody does now show up with reddened eyes, pink eye, that COVID is in the differential diagnosis, even if they're not coughing or whatever. So it's just now kind of a routine thing. Oh, maybe you have COVID. They could so easily be checked for COVID now because the COVID testing has improved so dramatically. And as long as we're talking about testing, there's tons of tests on the market. Now we don't need them so much anymore, but the new ones will test you for flu, flu A, flu B, COVID, and probably respiratory syncytial virus, RSV. So some combination of that will be on one test, and you'll be able to see which one of those things you may have.
That's very interesting. So clearly doctors and pediatricians are aware, as you said, it's part of the differential diagnosis there for COVID. If, say, a school teacher or a school nurse were to come across, a student with only showing pink eye as a symptom, would you suggest having them do a COVID test?
Well, yes. Yes, I would. Particularly if there's some other symptoms, but it's now part of the differential diagnosis of pink eye. The reason why you want to do that is because you can isolate those people, and if they are immunocompromised, you can treat them. So a school nurse, mostly the kids are pretty healthy, but maybe the kid has diabetes. Maybe there's another problem with the child that treatment would help. Since there is a treatment, it's important to make the correct diagnosis, and the treatment and the diagnosis now is easy and relatively inexpensive.
Absolutely. That's great to
So
know.
the free tests are going away with the pandemic. So that's just another whole issue that the free tests are going away, but many insurers will continue to pay for the tests. There are some plans, or there are some plans that exist that uninsured people can get tests. There's all sorts of things, but now it's going to just kind of get thrown in with all the other medical procedures and tests that people get.
Mhm. Speaking of those medical procedures, tests along those lines, the vaccines and boosters, we had a submitted question from a viewer who is over 60 years old. They received their Moderna bivalent booster 4 months ago, and they were wondering what the plan was for follow-up vaccines. Should they wait 4 months, 6 months?
This is the most common question I get. So just a little back up a little bit. On August 31st, Moderna and Pfizer came out with a new vaccine called, it's what they refer to as the bivalent vaccine. Half of it is geared towards the Omicron variants, which is what's circulating now, including this Arcturus variant, and half from the original Wuhan virus, the original virus. So it's an improved vaccine. It does work better than just the original. And like the flu vaccine changes every year. You're likely going to see, based on what variant is circulating, that this vaccine is going to change more. So if you've had that bivalent vaccine, which unfortunately only 17% of Americans have taken, it was not picked up, not used as much as we had expected, but it does work better. And so if especially if you're at risk, you need to get that new vaccine. So this person already had the new vaccine. So what I'm just recommending, the minimum time that you should take the vaccine is 4 months. So, but you could take it longer than 4 months ago. So I'm telling my patients now, wait till the fall when flu season starts and things get really confusing, and get your vaccine in the fall. You're probably very well protected. The reason why this whole thing is going away or going down into this endemic stage is because so many people have been vaccinated and so many people have had COVID. And a lot of people have had both vaccine and COVID, which is what we call hybrid. And that's actually the best immunity. So, yeah, so this person should get it. They don't have to rush and get it now, even though they could technically go in and get it. I would wait till the fall.
And what do you recommend on timing with the flu shot? Is it okay to get those within a few weeks of each other on the same day?
You can get them on the same day. We had stacked those doses up a little bit tightly at the beginning, because before everybody got infected and they had no immunity, all we had was the vaccine. So if you take them too close together, you have more side effects from them. But I think now, with everything kind of calming down, you can take them together or you can split them apart. It's really up to you. Personally, myself, I would split them apart by a few weeks, but it can go either way. It doesn't make any difference. They're going to work the same.
Mm-hmm. That's the most important part. Maybe it just depends on how you react to either one of those shots. So moving on to some headlines, we've already touched on this a bit throughout the episode thus far, but as of today, the Department of Human and Health Services here in the US has ended the COVID-19 public health emergency. What changes do you expect we'll see on a national level or, even locally?
Yeah, well, our system is pretty confusing. I mean, there's 1,600 insurance companies, multiple plans in each one. Then you've got Medicare, Medicaid, Affordable Care Act, the Veterans Administration. So those that are insured will still receive vaccines for free, most people. And vaccines are covered in the Affordable Care Act. So that's good, with no cost sharing, all right? Uninsured people are guaranteed to receive vaccines and treatment like the drug Paxlovid for free through next year. And then that's going to drop off too. These were all things that were attached to bills that were passed last year. The at-home test may or may not be covered by your insurance, kind of a hit or miss thing. And the crazy thing is that if the insurance doesn't pay it, they most likely will pay if you go to a hospital or outpatient clinic, register there, get charged for showing up there and get a test. It costs up to 10 times as much to do it that way, but they'll pay for that, but they won't pay for you to necessarily to get the test as an outpatient. It's a little bit crazy, but it varies by insurance policy. I think it brings up a bigger picture as more and more tests are available as just outpatients, including now birth control pills may be just over the counter. You can get an HIV test over the counter, but it's very expensive. There's a lot of things that are going to go in this over the counter, delivery system. And hopefully insurers will be smart and say, hey, this is a cheaper way to deliver these things. The tests are going to be fairly inexpensive, but when you put any price on it, people are going to think twice. Do I really need this? Do I have enough money to do it? It's a very you hate to have to make a decision based on the money. It all depends on what it costs. So we'll see how this pans out. So the emergency's over, so it's basically going to be a free-for-all.
Mm-hmm. And speaking of that, piggybacking on some of those changes, you mentioned earlier also that after today, laboratories will no longer be required to report their COVID-19 collection data. So, some states like Iowa stopped reporting a little bit sooner than that. Do you anticipate that some states still will report? How do you think that will affect the data we see?
Well, yes, we have 50 states, each with its own health department. We have 6 territories with a lot of people in them. Some of them, I mean, Washington, D.C., which is bigger, more populous than some of the states. Puerto Rico with millions of people. Guam, the Northern Mariana Islands, and, the Virgin Islands. We have all these territories. So there's 56 health departments. And in Illinois, we have 3. So we have the city of Chicago, the Cook County, and we have the state of Illinois. Fortunately, they really collaborated very closely together during the pandemic. But you can see that, with every state and even some cities within states all having their own policies, it's it's a little bit messy. It's not going to be consistent, and so it kind of depends where you are as to if they're going to continue reporting. Now, remember, it costs to do this kind of reporting is it's not free. I mean, there's people that are involved in it and whatever, and maybe they could be put to use, better use doing something else. And just like the CDC, follow the hospitalization rate and the deaths, which will continue, but it won't be on a daily basis anymore. We used to get numbers by the day. It was mandated that hospitals had to provide their daily numbers by the end of the day. So all that goes away. So it's most likely it'll be reported once a week or once a month or however they report their other diseases. And it's going to fall, it's like how we count flu, measles, and other diseases. So it's going to just be another disease that will be kind of loosely monitored, but the monitoring will be, it'll be okay unless they see a big flare up someplace.
Right. I'm sure that if we anticipate or we see a big flare up, there will be more reporting and definitely a lot of attention paid there so that we don't see a big flare up again. But I thought a really, really excellent quote that kind of wrapped up this change in COVID reporting was from the CDC's principal deputy director, Dr. Nirav Shah, who said, in short, we will still be able to see or to tell, that it's snowing, even if we are no longer counting every snowflake.
To add to that, Dr. Nirav Shah used to be the medical director for the state of Illinois. So he went from Illinois to the state of Maine and then was recently recruited down to CDC to be the principal deputy director with Dr. Rochelle Walensky, who announced that she's leaving her position. So it's going to be very interesting what happens with Dr. Shah. So he has strong roots here in Illinois, and we'll see what happens. I don't know what's going to happen down at the CDC with the leadership. That caught everybody a little bit by surprise. But it's been a really tough job during the pandemic. Has taken a lot of emotional and psychological toll on many of the healthcare workers. And Dr. Fauci still has 2 bodyguards when he went to the White House reporter dinner thing that they had. He had to come bring bodyguards. It's like it's a little bit crazy, but hopefully all that craziness now will just kind of fade away, and hopefully people will trust their health departments, and hopefully we're not going to have another pandemic anytime soon, but I don't know, we'll see.
Yes, we definitely will see. And that's a great place to wrap up. I'd like to say thank you to you, Dr. Murphy, for answering all the questions and giving your expertise. And a general thank you as well to all the healthcare workers out there who have done so much for their communities and this country during this very difficult time, this public health emergency. So thank you again. We sincerely appreciate it. And please don't forget to submit your questions you can comment under our Facebook video, you can send us an email, and we look forward to hearing and answering your questions in the future. Thank you, everyone.
Thank you, Katie.